We'll start with the total number of bones in the skeletal system. So around 200 bones are there, around 206 bones are there. जितना भी आप इधर देख पा रहे हैं, this class will be a bilingual class. I'll speak in Hindi, I'll speak in English, both. Whenever I speak in Hindi, I'll definitely translate that to English. तो मैं इंग्लिश में बोलूँगा तो मैं हिंदी में पक्के से ट्रांसलेट जरूर करूँ. राइट, आई मेक श्योर दोनों में से कोई भी छूट. Right? Okay, so you see here, whatever you see in the blue color, now भी आप blue color वाली bones देख पा रहे हैं. What are these? These are the bones of axial skeleton. Axis means the center of the body. Axis means center of the body. And whatever bones you can see over here, pink color, like shaded in pink color, they are a part of appendicular skeleton. Appendicular means something is attached. Something is attached. For example, at the end of the book, see there are some extra pages. आपके अंत में आप देखते हैं कि 5-10 extra pages होते हैं. What are they? They are appendix. So something which is attached to the center of the body, that is a part of appendicular skeleton. Okay. Axial skeleton and appendicular skeleton both are paired. Now, since this is the first class, this will be comparatively shorter class. I'll try to wind it up in less than 1 hour, right? Next, you see, depending upon your response, we'll just increase or decrease the pace, increase or decrease the content, right? Now, my kind and humble request, जैसे वो आर्टिस्ट लोग कहते हैं ना कि बीच में जी तालियां मार मार के दिखाते रहिए हमें, तो ताकि थोड़ा सा हौसला बना रहे. तो अगर आप अपनी क्वारी भेजते रहेंगे कि सर ये नहीं समझ में आया, ज़रा इसको डिटेल में पढ़ा दो, ज़रा इसको डिटेल में बता दो, ये चीज़ नहीं समझ में आई, तो थोड़ा सा एंथुजियाज्म बना रहता है. राइट, if you guys send your query, I'll be naturally much more glad. Right, now the number of bones in the axial skeleton are around 180. Here the appendicular skeleton are 126. Now, axial skeleton bone, they include the hyoid bone. They include the hyoid bone, right? Hyoid bone. This is the common mistake which we make, that hyoid probably is not a part of the axial skeleton. Axial skeleton also include ear, ear, right? Appendicular skeleton, clavicle, even though it is like centrally placed, फिर भी इसको हम appendicular skeleton का ही part मानेंगे, right? Now, what is the role of axial skeleton? Axial skeleton role is weight bearing and protection of the internal organ. Protection of the internal organ. For example, skull को बचाएगी brain को, ribs बचाएंगी lungs को, right? Whereas appendicular skeleton, what is the use? Locomotion. For example, walking, for example, moving our hands, locomotion, movement. Main question, that what diseases are common? What diseases are common? Okay, so in the axial skeleton, the diseases common are tuberculosis. Remember, tuberculosis, what is the most common site? What is the most common site? When we talk about adults की बात करें अगर, तो tuberculosis का common site क्या है? डॉर्सो lumbar junction. Write it in clear forms, avoiding the short forms. So common site in adults is dorsal junction of thoracic spine and the junction of lumbar spine. Thoracic spine and the junction of lumbar. Right? Okay. Right. Now, in children, slightly more common in the cervical. Slightly more common in the cervical. Common the cervical. Right. Next thing, what is more common here is about the tumor. What kind of tumor? Secondary bone tumor. Secondary. bone tumors, they are much more common, much more as compared to primary bone tumor, and their most common site is the axial only, axial skeleton only. Now, secondary tumor, most common primary, according to 28th edition of Love and Bailey, is prostate. Love and Bailey deals not only with surgery, it deals with orthopedics also. With orthopedics also. Right? So it says that the most common primary is prostate. Prostate cancer, the most common cancer which travels to the bone, which travels to the bone, and vertebrae, lumbar vertebrae, and thoracic vertebrae. Speaking about the appendicular skeleton, what diseases are more common? Osteomyelitis. Osteomyelitis is much more common in appendicular as compared to axial skeleton. Compared to axial skeleton, right? Then, so, sarcoma. Basically, we are talking about the orthopedics part only, right? More common diseases in the appendicular skeleton are osteoarthritis and osteosarcoma. The common primary malignant bone osteogenic malignant bone tumor of neck, right? You'll see the different parts, the long bone, part of long bone. You see, middle part, the long, it is called as shaft bone, and shaft is also known as diaphysis. Shaft is also known as diaphysis, right? At the ends, at the two ends, have something which is called as epiphysis. Thing which is called as epiphysis. Fine. So E for ends, E for epiphysis. Right, buddies? Now here, M for middle. So between epiphysis and diaphysis stands the metaphysis. Stands the metaphysis on both sides. Stands metaphysis on M for middle. So it lies in the middle of epiphysis and diaphysis. Middle of epiphysis, diaphysis. Right? Epiphysis. It is present at the ends. Present at the ends. What diseases are common here? So, giant cell tumor. Giant cell tumor, which is called as osteoclast, middle-aged females. Fine. Remember, there are 5 E's about stoma. First, it is located at epiphysis, fine. Physial location, not at the center but at one of the side, centric location, fine. It is pensile, eggshell crackling, eggshell crackling. Then N block. That means complete excision is the treatment. Complete excision is the okay. Now the diaphysis, also a shaft. What disease? Hair disease are Ewing, Ewing, and another troublesome disease, fibrous display, fibrous dysplasia, fibrous. Then most common true benign bone tumor. True, the word is true. Is that osteoid tumor. Most common true benign bone, also lies at diaphysis. Also lies at diaphysis. Secondly, see, diaphysis has primary classification center. Primary classification center. What is okay? Now, M for middle, M for metaphysis, right? Now, metaphysis, first it is extremely vascular, very, very vascular. In fact, it's the most vascular region of the bone, most vascular region of the bone. Now, even though it is most vascular, there is stasis, slow speed of blood. So, what this are the infection of the bone, osteomyelitis. And here, see, myelitis most age is here that common children, children. Okay. Now, then you osteo. What is special about osteosarcoma? It is the most common primary malignant primary malignant tumor of osteogenic genic primary malignant bone, the osteogenic. Okay. Now, then what else is found at osteochondroma? Fine. Osteochondroma is considered to be most common benign